series, the terms which are repeatedly asked in the exams. So let us recall and discuss those terms in alphabet mode, A, B, C, D, etc. So in this discussion, I'll be discussing the initial alphabet, important A, and I'll be discussing three terms from this alphabet. Attributable risk, very important thing, repeatedly asked in the exams. Annual parasite incidence, yes, malaria indicator, very important. Annual blood examination rate, most of the times you confuse between these two terms. So I'm keeping three terms now. Attributable risk, very important, I'll discuss. API, annual parasite incidence, and annual blood examination rate. So first, attributable risk. We calculate this from cohort study. We take smokers, non-smokers, exposed group, non-exposed group. Then we do follow. Then we get incidence in exposed and incidence in non-exposed. With the help of this, we calculate attributable risk. I will tell the formulas. I will discuss how to calculate. The word attributable is very important. Means if you get lung cancer, that is the outcome. The amount of lung cancer which can be attributed to smoking. The extent of lung cancer, see there, the extent of outcome which can be attributed to smoking, which is due to smoking. That is the importance of this indicator. Formula 1. Attributable risk is incidence in exposed minus incidence in non-exposed. That is why it is also known as risk difference. So if they ask risk difference, that is nothing but attributable risk. If I want attributable risk in percentage, the formula is exposed minus non-exposed by exposed into 100, because I want the answer in percentage, fraction or proportion. Both are same. When I discuss, both are same. The importance of this indicator looks the same in this side also, the other side also. But when I calculate, you'll understand the exact importance of attributable risk. For example, see the values given for you. Exposed, incidence in exposed is 10 per 1000, means for every 1000 smokers, 10 will develop lung cancer. Incidence in non-exposed, for every 1000 non-smokers, 1 will develop lung cancer. Even if you don't smoke, there is some amount of risk, that is very less, that is 1. When you calculate 10 by 1, that is dividing, you get ratio, that is different. Risk ratio I will discuss in my next slides. Here I am discussing the alphabet A. You know the formula. Subtract these two entities. 10 minus 1, that is 9 per 1000. What you mean? Matlab, what is the importance of this number 9? Check this image. This is from my class notes, which I use in my class notes. See this, very easy to understand. Very easy to understand. Incidence in exposed is 10 per 1000. Non-exposed incidence is 1. Okay, good. Even if you don't smoke, you get lung cancer. That is background risk. Means without smoking, you develop lung cancer, means there is some other factor which is playing a role. Smoking, no, not only smoking, there is one more factor which is playing a role. That is why they suffer 1 per 1000. That is called as background risk. That factor can play that amount of role this side also. Yes, I can't say no, because that factor is playing a role in non-smokers. That amount of risk can happen this side also. So we have to nullify that risk. That is what we are subtracting. 10 minus 1. 10 minus 1. The remaining 9. Yes, good. Then you are confident. Remaining 9 cases are attributed to smoking. Out of 10 cases among smokers, 9 cases are attributed to smoking. Yes, correct. Out of 10 cases among smokers, 9 cases are attributed to smoking. Good. So what I will do, I will bring all the smokers into one room. I will start counseling. Don't smoke. Stop smoking. Stop smoking. Yes, if smoking is eliminated, they stopped. How many cases can be prevented? Simple answer, tell me. Good, very good. 9 cases can be prevented. I don't know, I can't prevent that one more case which is due to another factor. So if smoking is eliminated, tell me good. Out of 10, 9 cases can be prevented among smokers. See the thing which I'm highlighting. 9 cases can be prevented among smokers. Good. Understood? With the help of this image which I discussed in class, it is very easy to understand attributable risk. If I want to calculate in proportion, percentage, very easy, same thing. 10 minus 1 by 10, use the formula 10 minus 1 by 10, 90%. Make a pie chart. This is also one more thing which I use in my class. Out of total outcome among smokers, 90% is due to smoking. 10% can be due to other factors. Very good. So write down important, out of total cases among smokers, 90% can be attributed to smoking. If I tell them stop smoking, if smoking is eliminated, 90% of the cases can be prevented. Good. So what is the inference of attributable risk? It will tell you the preventable component among exposed group. If exposure is eliminated, how much amount of outcome can be prevented among exposed group? Highlight the things. Preventable component among exposed group, important. That is by attributable risk. But how much of the cases can be prevented in the whole population? That is given by population attributable risk. I tell, repeat, listen. There are 3 things: risk ratio, attributable risk, and population attributable risk. What I am discussing now is A alphabet, so it is attributable risk. That will tell you the preventable component among exposed group. If they use the word preventable component in the whole population, population attributable risk. But risk ratio has nothing to do with preventable component. It will tell 10 times more risk, 8 times more risk. That's it. So these 3 things, again, cohort study importance. I'll be discussing all these in the classes. So in this A to Z series, A for attributable risk, very important. See the image, then they can ask the formula for you. 10 minus 1, that is 9. In proportion, it is 90%. Good, important. Can I go to my next term, that is annual parasite incidence? Very important, annual parasite incidence. So now coming to annual parasite incidence. Annual parasite incidence. So there are 3 words. Annual means 1 year. Parasite, that is related to malaria cases. Incidence means new cases. So it is very simple. When you split the words, there is nothing in this. It is new cases of malaria every year. That is the inference of this word. When you split the words, there is nothing in this. 1 year, malaria, new cases. That is simple. So formula is just like incidence, new cases divided by the population under surveillance. Usually incidence they express per 1000. For every 1000 in a community, how many new cases will happen? That is API. It is not annual parasite index. Don't make mistake. It is annual parasite incidence. Some books they say annual parasite index. No, it is incidence, new cases expressed for every 1000. What are the use? What is the use of API? So 1, to assess the impact of preventive intervention. Important. The word impact of preventive intervention. Like I give mosquito nets, insecticidal nets. Before, the risk was 3 per 1000 in that community. After giving insecticidal net, the incidence risk is 1 per 1000. So before 3, After it is 1. Good. Your intervention is working. Impact of preventive intervention can be assessed with the help of annual parasite incidence. Correct. Categorization of states under elimination plan. We have malaria elimination plan. We are targeting malaria for elimination by 2030. So based on this elimination plan, there are 4 states, category 0, 1, 2 and 3. I'll frame a question on malaria elimination plan separately, but here I am telling with the help of API, states are categorized. Yes. How many categories? 4 categories. Category 0, 1, 2 and 3. So that is all which is important at this point of time for this discussion. Later I will frame a question on malaria elimination plan. Later on we will discuss what is 0, 1, 2, 3 states, which is very important. Category 3, what we are doing, what is intensified control in the category 3 states. I will frame a question on that later. So there is one more use to plan elimination strategies based on API. If API incidence is very high, like in category 3 states, we do intensified control. So I repeat, impact of preventive intervention, correct. Categorization of states, correct. And to plan elimination strategies, what is the indicator we use? Annual parasite incidence. Just keep in mind, the word incidence is important. New cases. Good. Now come to ABER, annual blood examination rate. Again repeat, split the words. 1 year. Annual blood examination means slides collected, slides examined from fever cases. How many slides are examined in a given year? That is annual blood examination rate. Number of slides examined per year. So like every month you examine, that is monthly blood examination rate, MBER. When you take 12 months average, that will become ABER, annual blood examination rate. Good. Formula is very simple. Slides examined divided by population under surveillance, expressed in percentage. Percentage, that is per 100. Incidence was per 1000. Here it is per 100. Use of this indicator. Operational efficiency of surveillance. Health workers, whether they are working properly or not, whether they are collecting slides properly or not, whether the surveillance is done properly or not, both active surveillance and also passive surveillance. In both, the number of slides examined, whether they are working properly or not. So it should be more than 10%. If it is less, you are not efficient. It should be more than 10%. They will ask all these questions. Read the highlighted things. That is why I am using the highlighter for you. You will focus on that. In the exams, it is very easy to recall. Slides per 100, operational efficiency more than 10%. इतना ही याद रखना, इतना ही याद रहेगा. इसके आसपास मतलब जो भी अल्फाबेट ए से, listen. Incidence is new cases. Blood examination rate is slides examined. Once you know the formula, I will give one calculation for you. So see this question. In a community health center, population of 1 lakh under surveillance. Health workers collected 3,725 slides during their home visits, that is active surveillance. In the same year, 3,275 slides were collected from OPDs, that is passive surveillance. You go into community active surveillance, patient will come to your fever clinics, that is OPDs, that is passive surveillance. Fine, slides collected. When they examined, after collecting the slides, cases 105 positive for falciparum, 95 positive for Vivax. So based on the available information, what is the denominator? Population 1 lakh, that is very important. Then new cases, add both 105 plus 95, 200. Then check slides examined, 7,000. So when they give new cases, from that we calculate API. From slides examined, we can calculate ABER, annual blood examination rate. So now come to API. So for 1 lakh, there are 200 cases. For 1 lakh, there are 200 cases. So for 1000, it is 2. 2 per 1000, that is API. Now come to annual blood examination rate. For 1 lakh, 7,000 slides are examined. So in percentage, it is 7%. 7% is below efficiency. I told it should be more than 10%. If the efficiency is less, we have to give proper action and we have to give them proper feedback. So action and feedback is a part of surveillance. They are missing the cases, they are not going into the community, or they are not opening their clinics when the patient comes to them. So it is 7%, that is very less. So what they give, population they will give, new cases, API you calculate, slides examined you calculate, annual blood examination. Good. So this is calculation part. So we have finished 3 terms from alphabet A: attributable risk, annual parasite incidence, and slides examined. We are getting annual blood examination rate. So again there are 3 more terms from alphabet A. I'll put in my next video. So that will be total 6 terms in alphabet A. So what I'm doing this A to Z series. I'm giving terms for you which are repeatedly asked in the exams. So A, next I will go for B, after A. Also slowly we'll cover almost all the alphabets, whichever is important for your exam. So what you will be doing, just keep a small pocket book, write down the points which I tell, attributable risk, write down the slides, write down the points which I tell. Then only you'll click, this is the thing, when you write down, then only it is retaining in your brain so that you can recall in the exams, or else it is very difficult to retain and recall in the exams. You will revise, but retaining and recalling is important. Keep a small notebook. A, alphabet A, 6 terms. And what is that? Attributable risk, annual parasite incidence. Slowly one by one on small pocket book. Last में exam से पहले revise करने के लिए, it will help in the exams. And also before that to revise the most important terms which are repeatedly asked in the exam. So wait for next set. I'll post 3 terms again on alphabet A for you. So at this point of time, fine, good. Thank you so much.
मरघट तक है तेरी कहानी, पग पग प्यारे दंगल 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 दंगल। सूरज तेरा चढ़ता ढलता गर्दिश में करते हैं तारे, दंगल 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 दंगल। माँ के पेट से मरघट तक है तेरी कहानी, पग पग प्यारे दंगल 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 दंगल। सूरज तेरा चढ़ता ढलता गर्दिश में करते हैं तारे, दंगल 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 दंगल। धड़कने छाती में जब दुबक जाती हैं, पीठ थप थपा उनको फिर जगह बात बन जाती है। बावले हाथी सी हर चुनौती है रे, सामने खड़ी घूर के पड़ी आंख दिखलाती है, तो आंख से उसकी आंख मिला के भिड़ जाने का नाम है प्यारे, दंगल 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 दंगल।